It's a pleasure to be here. Thank you so much. So we will start. I tried to explain what we were facing in this new pathway. And I think that as a pediatrician, but also as a mother, we face a lot of issues when it's about giving diagnoses, you know. This is a new pathway, and we need to stop the delays that we have today to have diagnosis and start the future, because the kids, they need it, and it has to be something quick, delivering time matter. So this is how, when I started in March with a new pathway that was launched, I feel like the service was running. The thing is, everybody was working and very, very hard, but in different directions. And I think that that was the big challenge in the GHA, the different areas. So it was not that people were not doing nothing. It was a lot of work and hard work in different areas which was not coordinated. But the reality is the children were lost in the system. There was kids and families waiting for years for a diagnosis. And that doesn't mean that they didn't have the support that they need in the school or in the healthcare, because they were seeing different areas. But it was no diagnosis, no clear plan. And for this, it was a lot of confusion between the patient with the different, specialties, and we need to coordinate. So that was, I think, that the big challenge at the beginning. So the challenge that we identified at the beginning was the number of patients. And you can see that all of us, we know now in every family, some of the kids who are dealing now with a neurodiversion, different diagnoses, and we need to work on that. And the things are not that simple, because you can have one diagnosis, like, to give you an example, you can have ADHD with some trait of ASD, or you can have some dyslexia, and then doing the questionnaires or going through the pathway is going to be more difficult, because there is other things that we have to take in account. So average of the waiting time was a huge thing. Every kid was in a different area to be assessed, but it was different waiting time for every area. The staff turnover was a huge issue, because we are a small community with a number of staff limit in every area, maternity leave and things, and sabbatical, so we had to be covered, and this turnover of staff was causing a big impact. Also, the prevalence in the schools, we can see that every year we have more and more of students who will require more support for different issues. And this is now like the big rule, it's not like the exception. So we have more and more kids who require a lot of work. The limit access to the specialist service, we cannot do everything in Gibraltar. Sometimes we need to refer the kids to the UK system. And this is something that we need a lot of logistics. In summary, the demand was exceeding our capacity. So we need to think about that, and we have to have a new redesign of the service to give something that can be fitting with the new demanding. So the confusion and delays were not inevitable, and will not be inevitable, because we are evolving and we are learning from the pathway itself, but there were signs that we need to redesign us. Why this matter? Actually, this matter because the kids matter. They are our future. These kids are going to be in charge of the world. So we need to work with them. We need to understand what's the way. Something that I'm always saying in my clinic when we are doing the neurodevelopmental clinic, the kids come, and of course I'm sitting there as a pediatrician, and the most important thing is to clarify the kids that they are not sick. They don't have an illness. This is nothing wrong with them. We are trying to understand the way they think, the way they process the world externally, how they learn better, and give this information to the school or to everything and to the parents to understand the child better. So this child can be adapted and have a smooth journey in the school and succeed in their career. And this is very important because, as they say in the first talk, the language is so important. If the kid comes to the clinic and thinks something is wrong, my parents are bringing me because something is wrong with me, this is a wrong message to give. I always tell them, you have a superpower. Today, perhaps the school is not adapted for kids with this neurodivergent way to think, but this is the future. If the school today will be like a TikTok or like a YouTube channel, probably everybody will be more engaged, but we are not there yet. We still need to sit down, to pay attention, to repeat, to go home, do homework. And this is an adaptation that in the future school will be different for sure. So I always explain to the kids, this is a learning journey. And one day, whatever you have, ADHD, ASD, this is a superpower for a work. The managers, the CEOs, probably if they are in the spectrum, they're better. So this is very important that we always are in the same page with the doctors and with the teams, that we are there for to support, to make life easier perhaps, or find the tool for them to manage, but this is not a disease, it's not an illness. We have seen that the international evidence, if we work as a team, the outcomes are better for our patients. So this is what we were working in the GHA, trying to adapt in the whole areas to work one team. And the time care is not optional. This is essential for our kids. So this is how we think it was. So we have one goal. We need to be a strong, expert-led, well-coordinated service. When we have a timely diagnosis, the kid cannot be in the pathway for years. Target intervention, we need to know what we are doing, and a real support for all the children and families. So our slogan is here, one team, one pathway. So at the beginning we have different pathways that still we have, but we start now with just one triage, one referral way. We read every referral sent for every part of the community, GPs, schools, specialists, private doctors, and then we decide what is the way that the kids will go. The strategy that we have at the beginning, before March, before we launched the pathway, was to strengthen our teamwork and do like an MDT model, multidisciplinary. We also try to support and retain our staff, and of course the only way to do that is offer good training so everybody feel value and they can give something new and they can learn something new. And then enhancing our digital tools and system, we are now trying to change the whole system, so we are proof that we are not going to lose anybody in the way. And then improving our infrastructure and our clinical environment, so we are growing always on that. So since March to today, the design of the service with a new referral system, with the new structure, we know for sure that no child who enters the pathway is lost. The process, for first time, the service is functioning as an integrating. And as I said before, it was working a lot. Every area was working a lot. So the coordination, sometimes it was the failure, and now, it's easier to work together. And then what is next, of course, is to continue growing and to continue having a good rapport from the families, a good feedback, outcomes in time. So we are a huge team and we work with different areas. So we are the pediatrician and the psychiatrist. We have a project manager. We have an administrative lead for families. So not just to complain, but also to have some support where to go. We have a service, like an administrative service, and that was very clue in this system. Our education psychologist and the liaison in the SENCO in the schools. The care agency also work with us. Occupational therapist, speech and language therapist, physiotherapist, dietitian, the clinical psychology in mental health, and the behavioral therapist. Usually, we work all together. We have interesting multidisciplinary teams and meetings, and this is the only way that we found to make the things simple for the families. This is very important to understand because the patient journey, it doesn't matter about the diagnosis. It matters to all of us, but this is not something that is part of the journey. The patient has a need, and we have to understand what is the need. We need to assess that need, and from the need to the feedback and review, the kid will receive, and the families, all the support they need. The diagnosis is just a piece of that, who doesn't interfere. Nothing is like holding until we have a diagnosis. This is not what we are aimed to do. So once we identify what is the need of this patient, we start the referral, we start our pathway to start the triage the kid to have a diagnosis properly, but at the same time, all the therapists are working with them. And this, at the beginning, we have this clash, because for the doctors, we want to have a diagnosis. We want to put a label, because with the label, we know which is the pathway, which is the treatment. But we learn from our therapists that this is not the way we should work in this case. The kids have needs, and they need to be supplied, they need to be supported. It doesn't matter which is the name of the problem they are facing. So that's why we start working together, understanding that journey. So meanwhile, we are working on the diagnosis, the support is still received by all the therapists who were, super smart and, negotiating, like, this is the way we work and we should be respect like that. And actually, we learn about that. The needs, we understand that working on the needs base is what the families need. So after we have early intervention and the family support, the school-based support, I remember that we are very engaged with them and we try to work together. And then after, the new thing is we are evaluating our own process, how we can do best and better. So the implementation of the Roma, we couldn't do that alone because we need to learn from the UK. We were integrating with the neurodevelopmental service in Evelina Hospital. So they visit us, they saw how we were working, they correct our way in a lot of things, they give us suggestions, recommendations. And we also traveled there and we saw how they are working. And we learn a lot. So the next step is now we are planning for the therapists also to go and work together and the therapists to continue coming here. So this is very important because we are following standards. It's not like we are doing something with a limited budget. We have a limit budget like every business and organization, but we are supported, very, very well supported by the government to invest in this. So what success looks like is exactly like that. This is generated by artificial intelligence. I couldn't put a picture of our patients, but of course, this is what we aim to have. We want the kids to enjoy going to school. We want the kids to enjoy having a life. They can do everything, going to sport, having socializing, having a normal lives to be successful in their career because this is the future. So we're still asking, and we are very lucky in this country to have absolutely support from the government, and we are very close as a small community. We need the minister to continue supporting our vision and mission. Obviously, this is where we get all the training budget. Digital tools, we are having a new system that we are going to be able not only to see where in the pathway are every kid, but also to audit and to go back and see what we have been doing good or bad, and the bottlenecks, how to, fight with every problem in the pathway. We need to have a fit for purpose clinical spaces, and we will continue growing with that, and policies to support our joint working. We think that the structure is now in place, but now we are, working on that together with all the families, and I think that this is very important to continue growing. Yeah, so that is all. Thank you.